Buckley, Milford, MD. This morning's project is kind of a back butt project, B2B, right? These are called ports. You can see there's a little fat dripping out of this one here. These ports are just poked through the skin, and they keep the skin safe from our Vaser gadget, which is this gadget here. It has a little wand on it, which goes in through that little port, and with that, I can bounce fat cells off of wherever they're stuck using ultrasound energy. Comes in all different kinds of sizes. I mean, I do have shorter ones like that. I have thinner ones like that. I have longer ones like that. And they have differing numbers of little slots on the end that we call rings. And the ones that have fewer rings, such as that one has one, those are the more powerful ones. This one has 5, it's a more gentle one. I'm actually using this one today that has 5. Most of the time I use one that has 3, sort of middle of the road. But in any case, and you can see the fat continues to drip out here. I have a little plug in there to help keep what's in there until I start doing some liposuctioning. So our patient had some rolls, and there's still fat in there, and the rolls were stuck. That's what helps to make the rolls, otherwise the whole thing might just slide down, the thing meaning the back skin. But it gets kind of stuck down. They're called zones of adherence. I want to release those zones of adherence. There was one there, one down here. And I will suction the fat out of there in a moment. Then we'll go back over this whole area and give a plasma energy tightening treatment, which does a little bit of immediate tightening, but then it continues to tighten for maybe 12 months. That's not all. You can see here that our patient might want to have a little more curvature towards the backside up here on the upper buttocks. And indeed, we're going to make that happen. The lower back is going to be curved in, down, and this buttocks is going to come up. So we're going to do fat transfer, that's fat grafting, that's autologous fat transfer. As soon as we collect the fat, we have to sterilely collect the fat. We always sterilely collect it, but then most of the time we trash it. Some percentage of the time we use it for another project somewhere else on the body, like breast augmentation, butt augmentation, fat rebuilding, hand rebuilding. Sometimes we make it really fine fat too and do nano fat, whole different discussion. But wait, there's more. Also today, we're going to take a little blood a little later from our patient and spin it down, special tube, and we'll get some platelets out of there. And we're going to use platelet-rich fibrin matrix, and we're going to mix that in with our fat cells because there are growth factors contained therein, such as vascular endothelial growth factor. In other words, it's going to help these newly transplanted fat cells be happy in their new home and get a great blood supply, good food chain, in other words. So that's it. Whole backside, lower bra rolls, middle bra rolls, the waist, the hips, and then buttocks augmentation. You awake?
I'm awake.
And you happy?
Super happy.
Okay, you heard it. Awake and super happy. So you mentioned to me something about clothing and expense or excitement shopping or something like that afterwards?
Mm-hmm.
Yeah?
Mm-hmm.
So you have a plan?
Oh yeah, a whole new wardrobe.
Whole new wardrobe. And it may sound funny, and I kid you not, but there have been patients of ours who shared with me that their wardrobe expense subsequent to the procedure, after, was way more costly than the procedure. So, right? That would be what you would call a hidden cost.
Probably, yeah.
Right. Okay. So thank you for watching another episode of Milford MD, where we showed you and explained to you about Vaser, Renuvion, liposuction, fat transfer. I can show you how this goes under the skin for fun. See, went under the skin. Do you feel anything?
Nope.
Didn't feel anything, but she's awake and talking. And we normally have music on, we turned it off so you could hear me. Again, thank you for watching. Milford.